silahkan boleh menghidupkan kameranya. Sebentar lagi kita akan memulai untuk kuliah umum kita. Silahkan bisa dinyalakan kameranya. Teman-teman, silahkan kameranya bisa dinyalakan. Boleh dibantu juga mungkin Bu Eti untuk teman-teman dari Stikas.
Ya, siap dok. Ini sudah kami sampaikan di grup juga. Hmm.
Ya, teman-teman mahasiswa kedokteran, silahkan boleh dinyalakan kameranya. Ya, dinyalakan dulu kameranya. Ya, terima kasih Rahel sudah dinyalakan. Ayo, silahkan yang lain. Kameranya bisa dinyalakan. Kecuali misal memang sedang di toilet ya. Ya, baik. Rahel minta tolong teman-temannya mungkin bisa diinfo lewat grup ya, supaya menyalakan kameranya. Oke, baik. Sudah pukul 8. Kita akan mulai untuk acara pagi hari ini. Nanti akan dibawakan utamanya dalam bahasa Inggris, tetapi kalau nanti teman-teman waktu bertanya kesulitan dan ingin menggunakan bahasa Indonesia juga boleh. Nanti akan kami bantu. Begitu ya. Oke, ya. Good morning everyone. Good morning everyone.
Good morning.
Okay, thank you. Yeah, okay, that's good. Okay, thank you, Rahel, Stephanie. Yeah, we hope the artists will turn on the camera soon. And yeah, welcome to this general lecture titled Enabling Lives Through Teamwork, Occupational Therapy in Geriatric and Disability Support. Selamat pagi, Bapak, Ibu dosen, dan teman-teman mahasiswa sekalian. Salam sejahtera bagi kita semua. My name is Ida Ayu Triastuti and I'm lecturer at the Faculty of Medicine, Universitas Kristen Duta Wacana. I will be your moderator today. This event is held in collaboration between the Faculty of Medicine, UKDW, and Stikes Bethesda Yakum, and conducted online via Zoom and YouTube Live at FK UKDW. Dan kegiatan hari ini diikuti oleh dosen dan teman-teman mahasiswa dari berbagai program studi. Jadi hari ini ada mahasiswa kedokteran dari UKDW, ada mahasiswa keperawatan dan fisioterapi dari Stikes Bethesda Yakum. Mungkin beberapa sudah pernah ketemu ya waktu kelas kemarin, tetapi mungkin juga ada yang baru pertama kali ini. And Most of the students here are students who have attended the interprofessional education class. So this general lecture is expected to increase insight into interprofessional practice related to occupational therapy practice in service to disabilities and the elderly. Okay, wait. Can the screen? Who has shared the screen now? Would you turn it down? Would you turn off it? Okay. Yeah. For the operator, for Mbak Vivi and Mas Lukas, tolong nanti untuk share screen-nya boleh dibatasi ya. Begitu. Dari untuk sisi moderator dan pembicara dulu. Ya. Now, before we begin, here is the rundown of this morning activities. First, there will be an opening by our Dean of the Faculty of Medicine, Dr. T. Maria Mewati Widakdo. Then, the main session, a general lecture by Dr. Lynn Farley from Utah Valley University, and then followed by a discussion session, and ending with closing and documentation. To officially open today's event, we would like to invite Dr. T. Maria Mewati Widakdo, PhD, Dean of the Faculty of Medicine UKDW, to deliver her opening remarks. Dr. Maria, the screen is yours.
Thank you, Dr. Rita. Good morning, everyone. Good morning, Bu Etik Palupi. Thank you for coming.
Good morning.
Yeah. Good evening, Lynn, Dr. Farley. Yeah, Dr. Lynn Farley from Utah Valley University. It's an honor for us. Thank you. Yeah, it's an honor for us that today Dr. Lynn Farley gave her time to us to share, to give a general lecture. She will deliver a lecture on enabling lives through teamwork. We will learn about occupational therapy. Actually, occupational therapy is part of the medical rehabilitation for a long time, but it's still a lot, we can learn, Dr. Lynn Farley will share with us how occupational therapy can benefit, elderly patients and those with disability to improve their quality of life. Yeah, that's something that we should do. We should deliver when we deliver medical service, rehabilitation service to our patients. We would like to improve their quality of life, and occupational therapy can play an important role. As part of the teamwork, and this will also, I think, expand our horizon, increase our knowledge, especially related to interprofessional education. That is part of our main subject at the Faculty of Medicine, Universitas Kristen Wacana, and also Stickers Bethesda. We have had collaboration for a number of years, and today we are really lucky, we are honored to have Dr. Lynn Farley to share with us about occupational therapy. Thank you very much, and I hope we will all can enjoy and learn from Dr. Lynn Farley. God bless us all. Thank you, Dr. Rita.
Thank you, Dr. Maria, for the opening remarks. And we are very honored to welcome Dr. Lynn Farley, an occupational therapist and educator from Utah Valley University, USA. Mbak Vivi, please help to share screen for the curriculum vitae. Yeah. She will share her insight on the critical role of occupational therapy in geriatric and disability care, especially in interprofessional practice today. Dr. Lynn Farley, OTD, OTR, AL, I hope it's proper spelling, is the Director of Clinical Education and Assistant Professor for the Occupational Therapy Assistant Baccalaureate program at Utah Valley University in Orem, Utah. Dr. Lynn is an occupational therapist with a clinical background in geriatric, mental health, and forensic, where she worked with interdisciplinary teams to restore competency and increase health and wellness with her patients. She is a mother of 4 adult children and 2 perfect grandsons. Wow, amazing. And in her roles in academia, Dr. Lynn strives to facilitate learning opportunities that will challenge her students' thinking, encourage problem solving, and help students build upon concepts, ultimately turning concept into clinical skill. She also served as the vice president of the Utah Occupational Therapy Association, where she works with other clinicians across the state to promote and advocate for occupational therapy practitioners in Utah. Dr. Lynn recently returned from a trip to Indonesia, where she worked with the Cerebral Palsy Foundation, providing workshops and training for families in Wonosobo, Jawa Tengah. Ya, mungkin kalau teman-teman pernah yang ke sana, with children with cerebral palsy. She fell in love with our country and can't wait to come back, she said. Oh, thank you so much. That's so wonderful. Yeah, it is now time for our main session. Dr. Lynn, the screen is now yours.
Thank you. And does everybody understand English, or am I talking and then having interpreting?
You can share the presentation in English, but
Okay.
maybe you can
Speak
more.
slowly.
Yeah.
If you need me to slow down, let me know.
Okay.
My Bahasa is very bad. I learned some phrases from Maria while I was there, but I'm lacking. But thank you. I'm so excited to be here. As you can see right now, I'm also a therapy patient. I had my shoulder, my rotator cuff repaired about 3 weeks ago, so I'm in this sling for 3 more weeks, and I know I'm a horrible patient. My physical therapist, I've been just started therapy this week. So right now I'm a patient and a therapist. So it's hard to be a patient sometimes. Can you see my PowerPoint?
Yes, it's clear.
You guys can see it? Okay. Well, I'm very excited to talk to you today about occupational therapy in healthcare. My goals for the next little bit are to help you learn better what occupational therapy is. And then I want you to understand the difference between occupational therapy and physiotherapy or physical therapy. It's a little bit different. We'll talk about what occupational therapy does in geriatrics and disability, and then, how the part that we play in the team, right? We're all a team for our patients. That's the ultimate goal, is to help our patients succeed. And so we're just a very important part of that team. So, does everybody here know what occupational therapy is? I know when I was there with Maria, Dr. Udago, there's not a lot of occupational therapy in Indonesia. There is some, but we couldn't find a lot. So I wanted to kind of give you an overview. What is occupational therapy? So we look at occupation as anything that occupies your time, right? So if it's important to you, if it's something that you do, that's an occupation. So Playing video games is an occupation, right? Scrolling on TikTok can be an occupation. Doing homework is an occupation. Chores, all of those things are occupations. And then therapy, of course, is what gets you there, right? That's the treating an illness or treating an injury, rehabilitating that injury. So as an occupational therapist, if it's important to you, it's important to me. I want to be able to help you do that. And the beautiful thing about occupational therapy is that we get to use those occupations as your therapy. So in our therapy sessions, we might play video games, we might do homework, we might do chores, we do cooking, cleaning, surfing, right? We get to do occupations as part of your therapy. So it's a very client-centered health profession where we promote health and wellness through occupations. So we practice and use those occupations as our therapy. So if we have a child who is struggling with maybe fine motor skills, we can use video games or writing or different activities to help them become better with those fine motor skills. So our goal is to help people participate in things that are important to them. And so I want you to stop and think about what is your favorite thing to do, right? What is something that you love to do? One thing I love to do right now is hold and play with my grandchildren. I have 2 perfect grandsons that are amazing, and they love grandma. But right now, because of my injury, I can't lift more than 2 pounds, 3 pounds, right? And my grandsons are 30 pounds, 20, 30 pounds. They're 1 and 3 years old. So I can't hold them right now. And that's really difficult for me. And it's difficult for them because they say, Grandma, Grandma. And I say, I'm sorry, I can't hold you right now. So, when in healthcare, we are working with people who have injury, who have illness, right? Who can't do the things that they want to do or need to do. And sometimes it's very difficult, right? We see people at a very difficult time in their life. And so if you can kind of put yourself in that position and think, if that was my mother, if that was my sister or my brother, right, that was having this injury or this illness, right, it's very difficult thing for them not to be able to do things. One of the number one things that people struggle with is using the bathroom, right? Nobody wants help to use the bathroom, right? It's a very personal thing. And so that's usually one of the first goals people say, I want to use the bathroom by myself, right? It's very important and part of their independence. So imagine if you or your loved one couldn't do the things that you love to do anymore, right? Those occupations. That's where we come in. We figure out ways for them to be able to do those things that they need to do and want to do. So a couple examples from myself and some of my colleagues, right? Getting back to swimming or surfing after amputation. Maybe children in school that have a hard time writing or paying attention or sitting at a desk, we can help them. Somebody who's had an injury and wants to go back to work, right? Finding ways for them to be able to do that. Somebody in a wheelchair, right? Being able to play sports again or get back to different activities and finding ways that they can be independent in their own home or in their own work. Helping kids play. This is part of what we did in Wanasobo, working with kids with cerebral palsy. We did teaching them different ways to play. Play is a very, very important part of the way that children learn. And so it's a very important occupation for children. Another big part of what we do is we help, especially in the United States, older adults We help them be able to stay in their home as long as possible, stay out of the hospital, stay out of nursing homes, and places like that, so we can do interventions to help them stay home longer. So occupational therapy is a very holistic occupation, a very holistic career. So what does that mean, right? So when we look at our patients, we look at the entire person. We look at their cognition. We look at the way that their brain is working. We look at their sensory systems. We look at the environment that they're living in. We look at their social support systems, their emotions, their physical abilities, and then we look at what it is that they want to do and what they need to do. So cognition, we might assess their memory, see if they're having problems with their memory or their attention span. We look at their sensory systems, if they need, if they're having problems with touch or vision or hearing sensations. We look at their physical abilities, their strength. We look at their environment. A big part of what we do is looking at their environment and being able to adapt their environment to fit their needs. We look at their social supports and what help they have. We look at their emotional needs as well. Again, it can be really difficult to have an injury or an illness, and sometimes that can be as much emotional or mental as it is physical. And so we're able to look at all of those pieces of the person. We do different assessments, and then we build our interventions based on what we find, what they need, but it's all based on those occupations and what it is they need to do. And if you guys have questions, I'm sure Maria can and Ida can watch the chat for me, or feel free to come up and share. If you have questions, let me know, please. Or if I'm going too fast. We also work with people from the entire lifespan, so all the way from babies and children all the way into older adulthood. So we work all the way across the lifespan. And again, our goal then is to help people live their best life, do what they want to do. And sometimes it's a different way than what they're used to doing, but that is our goal, right? And so in the United States, we work all over the place. So occupational therapists, we work in hospitals. So we help people who have been sick or hurt get back to, again, doing those things that they want and need to do. We work on horse farms, and we call this hippotherapy. We have therapists who work and they put people and children on top of a horse and they do therapy on the horse. It improves their balance, it improves their strength, and it improves their coordination. And it does this faster than if they were just to do it on a regular therapy surface. This is a specialized training that therapists can do to learn how to do it, but it's a lot of fun and very meaningful for a lot of people. We work in schools, from children all the way through adults. We work in military. In the United States military, we have occupational therapists who work with current military members and veterans when they come home. If they have illness or injury, we work with veterans. We work in people's homes. We can go to their house. We can look at their environment and we can help them with their medications. We can help them with cooking. We can help them with dressing. So we can help them with a lot of tasks at their home. We work in outpatient settings. So in the clinic where people come, they have therapy, then they go back home again. And so these can be one-on-one, or they can be in a group. If we have a group of people, maybe a group of people with stroke, who have had a stroke or transient ischemic attack, we can work with them together. We work in the community, in different community settings, community gardens, vocational programs, adult daycare programs for people with cognitive or developmental disabilities. We work in telehealth, and so this would be doing therapy over the computer with somebody or doing things remotely, especially for people that live in very rural areas. We do a lot of that telehealth computer. We work travel therapy. There are occupational therapists who work in different places around the country. So they'll go work somewhere for 12 weeks and then travel somewhere else. But there are also therapists who work to help people with disabilities go on vacation and help them find travel that's accessible to people with disabilities. We do driving rehabilitation. So if somebody has had a traumatic brain injury or somebody's getting older, right, with aging adults that are losing sensation or, losing some sharpness, or somebody who maybe had an amputation, we can work on the skills that are needed and assess their ability to drive safely. Driving in Indonesia is very different than driving in America. No, we don't have as many scooters as you guys have. It's a little different, but it still takes a lot of skills to drive. And so we have specialists who can help people with driving rehabilitation. We also work in what we call skilled nursing facilities or nursing homes, and these are places for older adults that have different disabilities where they live together, and we provide therapy and services. So people with dementia or Alzheimer's disease, people who've had stroke, people that need additional care that can't get it at home would live in a nursing facility like this, where they have care, they have nursing, they have medical doctors, and they also have therapy as well. Another really cool place that we work is with NASA, so with the space program. So NASA in the United States is using occupational therapists to help astronauts maintain their physical and their mental health for those long duration space missions. So this is kind of a new and exciting area for occupational therapists. But it's a very cool thing to kind of think about, and I think this is a really great area. All right, so you can see anywhere where there are people, anybody where there's people with any kind of physical or emotional or cognitive disability, we can use occupational therapy. So if there's people, right, they need to do things, they want to do things, but for some reason they can't do it, that's where occupational therapy comes in. So what is the difference between occupational therapy and physical therapy or physiotherapy? Does anybody have any ideas on that? Usually my students talk a lot too, so.
Oke, mungkin silakan teman-teman yang dari fisioterapi ya. Bu Eti, hari ini mungkin ada apa ide untuk menjawab pertanyaan ini?
Ini ada Bu Gian ini yang dari fisioterapi.
Oh, ada.
Monggo Bu Gian.
Oke. So yeah, we have student
Mungkin
from
bisa sekalian
therapy.
sharing ini.
Ya, Miss Gian.
Hello, Miss Lynn.
Hello, Gian. I
How are
miss
you?
It's good to see you again.
Yes, I think differences about OT and PT. This is PT, the for the hard skill, but the OT for the fine motor, yeah. Physiotherapy for gross motor. I think this is.
Yeah, we OT focuses a lot on those fine motor skills, and PT does a lot with more gross motor. Is that what you're saying? Yeah. Yeah. I made a chart, right? of kind of the focus. Occupational therapy focuses more on function, independence, right? Functional tasks and skills. We focus on those occupations, and we use occupations in our therapy. Physical therapy focuses on movement, right? And so with my shoulder, my physiotherapist is working on stretching my shoulder and trying to get back my function that I had. The occupational therapist, me, I'm focusing on how do I wash my hands, right? How do you wash your hands one-handed, right? How do I put on my bra, my brassiere, one-handed? How do I put my shirt on without moving my arm? So those are focuses of the occupational therapist, while the physiotherapy is trying to fix my strength and my range of motion. Does that kind of help? So cooking is occupational therapy. It's very hard for me to cook with my left hand right now. I can't do it. And so I'm working with both, right, to get my function. So the goal of an occupational therapist is for us to be able to function and do things even while we're doing therapy, while the physiotherapist is working to restore my function and reduce my pain. So as an OT, my interventions surround a lot of ADLs, or activities of daily living. I work on cognitive rehab as well, so memory, how to do things, and also in modifying my environment. So right now I can't lift things over my head, so I took my plates, I took things, I moved them down to a lower shelf so that I can grab them without lifting over my head. So I changed my environment to meet my needs, okay? We use adaptive equipment also, so we might train our patients how to put on their socks with a sock aid, or I use a scrub brush to wash my hand right now because I can't use both hands, right? So we use different adaptive equipment to help people. We also we work side by side. In fact, my next office next door to me right here is a physical therapist, right? We all work very closely together to help the patient be able to function and improve. So, and we do work in a lot of the same places together. So where is OT's place on the team? So in the United States, most of our teams have occupational therapy, physiotherapy, we have medical doctors, we have a registered nurse or nurses, we have a speech language pathologist, so speech therapist. And I know you have speech therapy in Indonesia because I met some wonderful speech therapists over there. We have social workers, psychologists, and other, depends on the setting that we work in, but we have a lot of different members of the team. But we always have the same goal, which is for our patients to be safe and independent, and to improve their quality of life wherever that is for that patient. And no matter where we're at on the team, communication is very, very important. It's important for me to talk frequently with the physical therapist. I talk frequently with the doctor. I check in with my nursing staff. I check in, with the patient's family. The family is another important member of the team to see where we're at and what we need to do. And so communication is very, very important. But it's also important for me to know what the other members of my team are working on and what they know, so that I know where I fit in on that. So in geriatrics, this is an area that I worked quite a bit with, working in those nursing homes with older adults that have had stroke, dementia, Alzheimer's, and cerebral palsy, multiple sclerosis, some different diseases like that. So one of the biggest things that occupational therapy does is we work on those ADLs, those activities of daily living, and we work to help our patients be as independent as possible. We want them to do as much of the task as possible. And so again, we might do an assessment to figure out what's wrong, like why they can't do it, and then we find a way for them to do it. Sometimes we change that environment and sometimes we help train. We look at the home or their workspace or their home space, and we look for safety factors, fall risk factors. We look for ways to make sure that they can be safe and we can modify their home. We look at memory strategies and cognitive strategies. So sometimes that's, planning and thinking or creating visual strategies for people. Again, we use adaptive equipment or assistive devices for people. Technology has been an amazing invention in the last, 20 plus years. Technology has grown so much. There's quite a few different pieces of technology that we can use as well. Another big piece we do is we educate their caregivers, the family members, the people that they're working with, on how to transfer their patient, how to move them to the bathtub, back to the wheelchair, how to be safe, not just for the patient, but for them also. We don't want caregivers getting injured either. And we look at what is the best place for this person to be, right? Can we get them back home? Can we help them participate socially? What can we do to help them be independent and healthy and happy? So I have homework for you guys. I have a case study for you, okay? So we're gonna look at Mrs. Siti. She's 68 years old. So her medical history, you guys are medical students, right? She has hypertension, mild dementia. She had a left-sided ischemic stroke, right? Before her stroke, even with the dementia, mild, and the hypertension, she was very independent with all of her dressing, all of her hygiene, helped with cooking, helped with chores. She lives with her daughter and 2 grandchildren in an apartment building in Jogja. So right now, after her stroke, she has difficulty with mobility and balance. She can't dress or bathe herself independently. She has some short-term memory loss and confusion. She's a falls risk, so she's at risk to fall while she's home. She has a hard time managing her medications. She can't remember what she took and when she took them. She's tired. She's having a hard time doing things. She gets really tired. And she's not socializing with her friends. She's not going to prayer groups. She's not going to church. She's all the things she used to do, she's not doing anymore. So what I want you to think about is with Mrs. Siti, what is the role of each of these different members? So as the medical student, what is your role in the care of Mrs. Siti? And I'll kind of put this back up. But what would the doctor's role be in her care? You can think about it, you can put it in the chat, or if you're brave, you can come up and talk.
Okay, baik. Okay, student from the medical faculty from UKDW, please give attention to this case study and give your idea about what should we do as a doctor, as a medical doctor for this case. So what should you do? You can speak with unmute your audio, or you can put it in the chat box.
What do you think? If you were her doctor, what would you look at? So the doctor might manage the hypertension, right? You might prescribe medications to manage the hypertension or post-stroke medications, right? You might give a referral to occupational or physical therapy so they can get in therapy, and you might manage the care as the medical doctor, right? The nurse might help with medication management, monitoring blood pressure, and watching to make sure for signs of stroke, again, make sure that it doesn't reoccur. A speech therapist might work on swallowing, feeding, speaking. If they're having if she's having a hard time speaking, the speech therapist can work on communication. What do you think the occupational therapist would do for Mrs. CT? What would the OT and the PT be working on? Yes. Yossi, is that Yossi? As a medical doctor, maybe I'd make the medication label more clear, educate the caregiver how to administer effectively each of these medications for the patient. Yes. You'd be prescribing them and making sure that they understand what they need to take. But Mrs. CT, when she gets home, she forgets. She has a hard time because she has some memory issues from her stroke and she forgets. So what could the occupational therapist do, right? So that's where an OT can help and work with and devise a system where maybe we help them create a medication box for them, or set up a timer or alarms or visual things that to help them remember when to take them, right? Yes, so OT activities to increase memory and mobility. Yes, dressing, bathing would be occupational therapy, and the PT could help them with mobility and balance. Yes, absolutely. That was a beautiful answer. Okay, so you can see all these pieces work together, and a lot of times I will work on dressing at the same time that the physical therapist is working on mobility and balance. So maybe I have a patient sitting at the edge of the bed, right? And the physical therapist is behind them, helping them with their balance while I'm helping them learn dressing techniques. So we work together at the same time, even sometimes where we're working on two different things. So it works really, really well together. Let's see, did we get everybody? You guys are great. Okay, so yeah, OT, we would do an assessment with Mrs. CT. We would say, you know, how is she doing with her toileting? How is she doing with dressing? We could look at cooking tasks. Is she safe to cook in the kitchen? Or, you know, does she need help with that? Can she balance? Maybe we can, you know, fix things so she can do some things sitting. We would look at her, you know, how she gets around the house. We would look at her memory, just like you guys said. And then we might work on, you know, one-handed dressing, one-handed hygiene. Maybe she needs grab bars or a shower chair or non-slip things in her bathroom. And training caregivers also. And PT does that too, where we can work on training caregivers to be safe. The other thing we work on is energy conservation. So, you know, doing the things that are really exhausting. If you've ever showered or tried to take a bath after you've had a surgery or an illness, it's really tiring, right? So we can work on when to do those things so that we save our energy for those important things. And medication. So I wanted to share, this is a research article that came out of the United States. It was a very big research that was done, a very large project, where they researched one of the problems we have in the United States is that a patient will discharge from the hospital, they'll go home, then they will relapse, they'll have like a fall or re-injury or another stroke, and then go back to the hospital. And so they wanted, and it's very expensive when they have to go back to the hospital after they've been home. So they wanted to research and say, why is this happening and how can we keep people home and out of the hospital and healthy? And so they did this big study and they found there was one factor that made a huge difference in patients' readmission rates, and that was occupational therapy. So hospitals that were spending and had very strong occupational therapy had lower readmission rates. So they had less people coming back to the hospital. So the more they spent in occupational therapy, the less likely they were to have somebody come back within 30 days. So they were stronger, they were healthier, they were less likely to fall once they got home. They knew how to do things. They had improved safety. So OT, again, we look at that functional and social needs that are really important for people to stay safe after they discharge. They were able to stay safer at home and had better and more support at home for their ADLs with caregivers, and they had improved quality of care, right? So they found that investing more in occupational therapy proved that people were doing better once they got home. And occupational therapy was the only thing that really made the biggest difference. So this is a really important study that came out that that they've recreated and shows some really how important it is to teach people how to live, right? It's important that we teach people also in the context of their own life and what's important to them and how they do things in their own home. And so I can talk all day about occupational therapy. I'm very passionate about it. I think it's amazing, and I've seen people's lives change from it. So I love it. But I recognize it's just one part of the team, right? And it's very important for everybody to work together to help our patients. So just kind of in recap, OT is a very important part of rehabilitation teams for people that have injury and illness, whether they were born with it or not, right? It's a very important part of the team. One of the main things we do is focus on function. We focus on functional tasks. We focus on getting people back to what is important to them, right? Those things that are important or meaningful to them, we want them to do. We are different because we actually use those occupations as part of our therapy, right? We use cooking, we use cleaning, we use dancing and surfing and running. We use all those things as part of our therapy. And we work very closely with teams. We're very team oriented, right? Whatever is going to work best for our patients is what we want to do. So we're a very important part of that team. So I would love to kind of answer questions or terima kasih for being here today. I thank you. It's very exciting to get to meet with you all. I'm very excited for your journey in school and wish you the very, very best. And love to answer any questions you have about occupational therapy or geriatrics or others.
Okay, thank you so much, Lynn, for that inspiring, insightful presentation. It's so beautiful how occupational therapy make people stronger, healthier, and improve the quality of care, of course. And working as a team is very important. That's a beautiful sharing. Okay, maybe we can give like virtual applause, which one? Or you can send others reaction for Lynn preferred sharing. And yeah, we will now begin the Q&A session. You are welcome to ask your question in English or Bahasa Indonesia. We will help translate if needed. Silakan jika Bapak Ibu atau teman-teman mahasiswa ingin bertanya, dapat disampaikan melalui fitur chat di Zoom, di kolom komentar di YouTube juga bagi yang mengikuti lewat YouTube, atau bisa langsung dengan mengangkat tangan raise hand di Zoom. Baik, silakan. Oke, Dr. Saferina Nungki, raise hand.
Yes. Hello, good morning and good evening there, right, Lynn?
Yes.
It's quite early morning here. My name is Nungki. First, I want to thank you for your time in presenting everything about occupational therapy today, and I also want to thank to Dr. Mari and Dr. Ito for organizing this meeting. As a lecturer, I learned a lot from the way you teach and present the materials. It's very interesting, and also about understanding other health professions, especially occupational therapy. And I think it's really important for our students to understand about the rules of OT, particularly in geriatric and disability patients. I have insight to explain it to another health professions and now for our students maybe. So my question is, do you have any experience how interprofessional education is practiced in the place you work? I want to get insight about how IPE done in clinical setting. Thank you.
Yes. That's a great question. So we have a couple of different ways that we do. We think interprofessional education is very important. And so one of the things that we do is we do these interprofessional education events or experiences. And I believe you guys do something similar where we come together. We have, occupational therapy, physical therapy, medical doctor students, nursing students, even dental students, speech therapy. So we have a lot of different disciplines. We come together, and we have a simulated hospital. So it looks like a hospital. It feels like a hospital. It is a hospital, and it has cameras right in the room. And so we come together, we have a patient, and the patient has it. We get the case study, we do a chart review on the patient, and then we come together and we have like a team meeting where we get to meet the patient. We each get to interview or do an assessment on our own. And then we come together and we have a meeting. What would you do for this client? What would the plan of care look like for this client? What does each person do for this client? And we treat it like this is your patient. Now, help this patient. And so we do that from all different disciplines together, like we would do in a hospital with a team meeting. And I will admit the first time that I participated in that, I said, why is dentist students here? Like, what does dental have to do with any of this? And when I left that experience, I was like, oh, like dental hygiene is a very important part of healthcare, right? And I didn't know that it can affect blood pressure or, different things like that. And so I learned, that was when I was a student going through the process, that even dentistry, and some of those others are very important pieces. And so it was eye-opening for me to learn what all the other disciplines do. Another thing that we do is with OT and PT, again, we have a clinic. And so we will actually see patients that will come in, and we can actually see patients together and we can treat them together with OT and PT. And so that's been a very important piece as well, to have real clients that come in. They can be treated for free or for very little cost in our clinic that we have here under the direction of therapists with our students. And so we have different therapists that oversee that are licensed, that oversee the students and the plan of care. And then we also do clinical education out in the clinics, the hospitals, the schools, where they have the opportunity to work with other disciplines as well. So we have quite a few. I've been working with Maria. I'm hoping I can bring some of my students over there and, work again. So different.
Okay, thank you, Lynn. Here we have interprofessional education, but in undergraduate. So we invite the student from nursing and also from pharmacy, and we collaborate together in a small group role play. So we invite patient standards, and we do role play in small group, something like that. But
Yeah.
we have idea to expand this learning of IPE in clinical setting. So I don't know,
Yeah.
maybe we can do what you do in your clinics. We do a case discussion together with a real patient case with other profession, maybe something like that. Thank you for your
It's tricky. I
sharing.
think it's tricky to facilitate because each discipline is at a different place in their education. And so sometimes it's hard to say, oh, we're not here in the summer, or oh, we're not here, or we don't know enough yet. Like it can be kind of tricky. One of the other things that we're doing that I really like is we have nursing students come and teach our students how to take blood pressure, how to monitor heart rate, how to move a patient that is connected to IV, right? How to safely, work around intravenous fluids and things like that. And then our students teach them how to transfer safely. And so we have our students teach each other, right? Because then that solidifies their knowledge and when they teach other people
Yeah.
how to do it. And so just between nursing and OT, we'll have them teach how to take a blood pressure, how to check oxygen, how to do that, how to move the cords around, and then we teach them how to do safe transfers to the wheelchair, to the bed, things like that.
Yeah.
So that's been good too.
Yeah.
Easier.
Yes, I agree with you. Thank you, Lynn.
Yeah, thank you. It's exciting.
Yeah, thank you, Dr. Nukia, for the question. And yeah, thank you for the example, Lynn, because yeah, it's very tricky. We in every where in health profession, we always say this field is busy and yeah, we don't have time yet. Yeah, yeah, but thank you for the example. Okay, maybe we have other question. Okay, you can raise your hand or put it in the chat box. Bu Eti, please.
Yeah, thank you. Hello, Dr. Lynn. Hi,
Hello.
nice to meet you again. And
You
the
look
first
familiar to me.
yeah, our first meeting is in our campus in Stikkersbetes David
Yes.
Kian. Yeah, yeah. I'm sorry to hear that you have fallen and broken with your with your hand. Yeah. Thank you for your nice presentation and make me for myself. You make me like insight about the OT differences between OT and PT, and I'm agree with Dr. Nungki about IPE and IPC because it seems like there is no there is no line or which one is for OT or for PT and also for nursing. For example, in Indonesia, we teach the students is to take care of the patient for make the patient more independent for bed dressing and take care of the patient to take a bath or something like that. And based on your study case, you said that the OT have slight have a job for increase the independence as well for dressing and bedding for the patient. So, would you mind to please to give us it's like picture or sharing about the condition between the collaboration in the hospital between nursing because I am a nurse.
My mom and
Nursing,
my mother was a nurse.
yeah. between nursing to it's like make the patient more independent. Between nursing and OT in the hospital is for based on your study case that you present before. Thank you.
Yeah.
Lynn.
I'm trying to think. I can give you an example. When I had patients, when the nurse or the nurse assistant would do showering, at least in the United States and from my experience, nurses are very busy. Nurses have a lot of patients and they are very busy. So when you go in to shower a patient, what do? You do everything for the patient, right? You like hurry, you wash their hair, you wash their
Yeah,
body, you
in
set their arm.
Indonesia, we do
do.
all of them.
You do it all.
Yeah.
So when I go in to bathe and shower a patient, I say, no, you do it, right? You do it. And so sometimes patients go, no, I don't want the OT. I want the nurse because I don't want to do it, right? But I say, the nurse can't go home with you. Like you have to learn to do it yourself. So when I go in to shower help a patient shower, I have that patient do as much as they can by themselves. And then I help them. I find ways. I say, no, I'll do this and you do the rest, right? I'll start, you finish, or you finish and I start, right? So that's the biggest difference is I don't do it for them, right? It takes me longer and I get very wet, but the patient does it. And so my job is not to do it for them, but to help them be able to do it themselves. So I think that I had one patient, whenever I walked in, he'd be like, no, the nurse can do it. And I say, nope, we're doing it. Let's go, right? So I think that's one of the biggest differences. It's not my job to do that, but to help them figure out how to do it. So does that help?
Yeah. Okay. So based on this condition, I think it would be nice if it's like make the students from nursing, from OT, PT, doctor, and some pharmacist or the health provider to it's like learn how the differences between our role in from IPE and also in IVC. Because sometimes the students confuse between which one is our role and which one is another role, something like that. So I hope that in the future we can collaborate with IPE and maybe next time IPC.
Yes. Yes.
Yeah, nice
I need
to
to come back.
yeah. Please welcome to Indonesia in Yogyakarta.
I looked up recipes to make soto.
Ah,
I'm gonna
do you
try.
like it?
I do. I'm gonna try. I got two recipes. I'm going to try to make soto.
Wow. Oh, yeah.
We'll see.
Nice to hear that. Yeah. Thank you, Dr. Lynn.
It's good to see you again, Ati.
Yeah.
Yeah, thank you, Bu Eti and Lynn. And yeah, we are so sorry because we have to end the Q&A session here due to the time limitation. Thank you all for the great question discussion. Today we have gained valuable insight into how occupational therapy contributes to collaborative care for older adults and people with disability. And we hope we can learn how to practice this insight when we in the interprofessional practice one day. Ya, sebelum kita akhiri, kita akan mengambil foto bersama sebagai dokumentasi Bapak Ibu dosen dan teman-teman, sehingga mohon menyalakan kamera. Dan bagi yang belum mengisi link presensi hari ini, silakan untuk mengisi cukup sekali saja. Okay, let's take a group photo together. Let's turn on your camera. And we have many screens, 10 screens in my laptop. So please hold. your smile. I will take a picture. Okay, smile everyone. Wait. One, two, three, four, five, six, seven, eight, nine. Okay, almost. Wait. And 10. Okay, yeah. Thank you, everyone.
Terima kasih.
Terima kasih.
You have
So
to send me, Ida, you have to send me the pictures.
okay, of course, yeah. Yeah, it's thank you again, Lynn, for the excellent presentation and discussion. We hope and pray your shoulder will get better soon
Thank you.
and strong in the physical therapy.
It's so painful. Maria, my mother said to say hello to you.
Thank you. Please say hello. Please send my kind regards to your
I
parents.
just got her home on Tuesday. So
Oh, that's nice. Oh, that's good. That's a safe flight back to the US.
yeah, they're very tired, very jet
Oh,
lagged.
yeah, it's a long trip.
Yeah.
But yeah, I'm happy to know that they have arrived safely and gather with the family. Yeah,
It's
I'm sure
wonderful
that
to
you're
have them
happy
home.
to be with the children and grandchildren.
Yes, it's very
Yes, that's
fun.
awesome.
Oh, thank you guys. I hope this
Thank
was
you. Thank
I
you.
hope
Terima
this was
kasih Bapak Ibu
helpful.
dosen dan teman-teman yang telah mengikuti dari awal sampai dengan akhir. Now you can leave the Zoom and have a wonderful day ahead and see you. We hope see you in our next session we hope in the future collaboration. Yes, Bu Eti. Okay, bye everyone. God bless you
Good
all.
night.
Thank
Thank you,
you.
Lynn.
Thank
Get
you,
better
Lynn.
soon.
Thank you, Dokter Maria. Terima kasih. Salam dari Bu Nurliah.
Terima kasih. Salam kembali untuk Bu Nurlian. Makasih.
Sehat-sehat ya, Dokter.
Ya, makasih. Sampai ketemu
Yeah.
di Bugian, ketemu di
Iya.
online.
Dokter Rida, Dokter Nungki, terima kasih sekali.
Terima kasih, Bu Eti.
Iya, saya jawab Dokter Nungki sebentar. Saya
Iya.
list ya.
Izin live. Terima
Iya,
kasih.
izin live. Terima
Selamat
kasih.
pagi.
Teman-teman mahasiswa jangan lupa isi link presensinya ya. Oke.
Mohon izin live.
Ya, kami akan close ya.